I'm sure having your wisdom teeth removed is not at the top of anyone's to-do list, but if that time does come, do you know what to do? Dr. Bernard Krupp from the Krupp Ctr is here to tell us all about it. Dr. Krupp, welcome.
It's my pleasure being here.
All right, so why would anyone have to have their wisdom teeth removed?
Well, according to all of the anecdotal research that's done by the oral maxillofacial surgery group, most of the time wisdom teeth become a problem, either pathologic with tumors or jaw cysts. They cause a lot of crowding, which then makes your kid want to have to go get orthodontics, which is an added expense. There are a lot of pathology, a lot of trauma, and so it's really better for them to be removed prophylactically between the ages of 16 and 19, which is actually when the teeth are two-thirds formed. And that way, there are less complications like nerve damage, nerve injury, and so forth. So it really is the recommendation of our association that wisdom teeth be removed and at that age range.
So walk us through the process. It's not something that's too painful, is it, or
well,
can it be?
It depends on the patient, and I think to some extent it may depend on their patient's mindset. We see patients, and you have to understand, I've been doing this for 27 years. I'm a board-certified, trained oral maxillofacial surgeon. So when someone comes in, it's not like going to your general dentist to get your wisdom teeth out. It's going to be a totally different experience. So we do a consultation process first to make you feel at ease. And then we bring you back, and most patients, probably 95% of my patients, want to go to sleep because they really just want it to be over with. They're nervous and so forth. It takes us an hour center, about 15 minutes to take the wisdom teeth out. And the patient goes home with a prescription for pain medicine. We've had, I mean, I can't even remember the last 15 years or so I've had a dry socket or any other problems.
Knock on wood.
Can knock on wood. And the patients are generally have some discomfort for a few days. They take a long weekend off, but pretty much that's the way it goes.
So why are we seeing more and more adults that are just now getting their wisdom teeth out?
Well, primarily it's because the general dentists either have not recommended that because they were afraid and didn't understand a lot about it themselves. And so if they're afraid to recommend it, what you need to do as a good consumer is say, look, you know, if you have children, you've got 2 young children, what's the right timing for my kid to have their wisdom teeth out? And that kind of forces them. And I think today, because there's a lot more continuing education in both medicine and dentistry, people know now that this is the right time, it should be done.
And so the recovery process isn't that long. I know in adults you're talking, I mean, obviously
it's also a little bit longer.
Right.
You know, a few more days. Look, any surgery that you have, there is a post-operative recovery time. The question is, what can you do to make it easier? And what we do is we give preoperatively, we start an antibiotic. We give something in the office to help diminish the swelling and the pain. And so
I'm sorry.
Yeah, so we do what we can.
I was just going to say, is earlier better as far as financially speaking? Because then you might actually, miss the boat on braces altogether. Well,
in terms of orthodontics and wisdom teeth, most orthodontists are going to refer the patients to me during their treatment, if not before. They want to make sure that after they've done the braces, there's not going to be a lot of relapse, and wisdom teeth will cause relapse of the braces.
Okay, good to know. Good information. Thank you, Dr. Krupp.
Thank you.
Whether it's your wisdom teeth or a dental question, let the Krupp Ctr walk you through all of your oral health needs. Make your appointment today by calling 1-800-617-0705 or visit them on the web at KruppCtr.com.